Hi, my topic is on dementia. Dementia is referred to as the umbrella term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. There are many forms of dementia, with Alzheimer's being the most common cause of dementia. Dementia is caused by abnormal brain changes which trigger a decline in thinking skills. It affects behavior, feelings, relationships, and much more. Some things you might notice with someone with dementia could be issues with their short-term memory, like if they can't remember what you just told them, or if they tell the same stories more than once. Keeping track of their purse or wallet, paying bills, planning meals, remembering appointments, and kind of getting lost, like going outside of the neighborhood and types of things like that. Some signs of dementia include decreased problem-solving skills, perceptual skills, and problems with communication, language, and personality changes. The picture on this slide depicts how dementia is an umbrella term for the different forms of dementia. Dementia is caused by damage to brain cells. The damage interferes with the ability of brain cells to communicate with each other. We've learned that the brain has many distinct regions, so when cells in a particular region are damaged, that region cannot carry out its functions normally. Different types of dementia affect different areas of the brain. So in Alzheimer's disease, high levels of certain proteins inside and outside brain cells make it hard for brain cells to stay healthy and to communicate with each other. The hippocampus is the center of learning and memory in the brain, and the brain cells in this region are often the first to be damaged, and that's why memory loss is often one of the earliest symptoms of Alzheimer's. Treatment of dementia depends on its cause. There is no cure for dementia, but there is medication listed on the slide that is used commonly for Alzheimer's, which helps remove amyloid in the brain in order to reduce cognitive and functional decline. Caregivers and therapy can improve quality of life and temporarily slow the worsening of dementia symptoms. Occupational therapy interventions for those with dementia include health promotion by focusing on strengths of clients, promoting wellness of care providers, and providing maximal performance in preferred activities. Remediation by incorporating routine exercise into interventions to improve the performance of ADLs and functional mobility and to help restore range of motion, strength, and endurance. Maintenance by providing supports for the habits and routines that work well for the person with dementia and that can be maintained to prolong independence. Modification to ensure safe and supportive environments through adaptation compensation, including verbal cueing, personal assistance, and social supports. OTs can help provide improved function through compensation or adaptation, help individuals retain existing function for as long as possible, and help them live in their own home safely for as long as possible through environmental evaluation and adaptation. OTs also promote wellness programs for fall prevention and educate the caregiver and family members. Relevant team members for dementia include geriatricians for managing problems that affect older adults, including dementia, neurologists to assist cognitive symptoms, geriatric psychiatrists to address behavioral and emotional changes, psychologists to help adjust the diagnosis of dementia, neuropsychologists to evaluate cognitive disorders to help figure out the cause of the symptoms. Speech and language therapists can be used to help individuals with dementia improve their ability to express their needs even when they can't find the right words. Obviously, occupational therapy to address home safety, make environmental modifications, and plan activities to facilitate the care of dementia clients. And a geriatric care manager to assess social supports that are needed to cope effectively with present stresses and plan for the future. Tip I'd like to add for relevant referrals to allied health professional includes just to start with a primary care physician when they first develop signs of dementia to determine if these signs of cognitive impairment are connected to other issues rather than dementia. Risk factors for dementia that cannot be changed, unfortunately, are age and genetics, and adopting multiple healthy lifestyle choices, including a healthy diet, not smoking, regular exercise, and cognitive stimulation may decrease the risk of cognitive decline and dementia. And these are the references I used.